Welcome back to Starting a Business Simplified. I'm Suzy Wraines, and in this episode, I have guest speaker Lori Schellenberg. She's an RN, nurse case manager, and patient advocate. She's a small business owner of a patient advocacy business called Stepping Stone Advocacy Services, and she just launched it in January 2023. So when you're listening to this episode, it will be a year later. She's been an RN and a nurse case manager for over 40 years, and she's here to share her story and her history of her experience as a patient advocate. We have a great conversation around how to get started if you're thinking about becoming a patient advocate, and how she's helping nurses to transition and do something that they love with the experience they already have. I'm so excited for this episode, so let's get to it. Hi, Lori. Welcome to the podcast.
Thank you. I'm really happy to be here today.
I introduced you before we started recording. I would love for you to just introduce yourself to the audience and share, how did you get where you are with what you're doing?
Well, I've always kind of been a person to think outside the box. I've been a nurse for over 40 years and a nurse case manager for over 20 years. And raising my kids, I have four children, and raising them around my husband's shift work as a firefighter, I oftentimes had to, depending on where the kids were in their lives and what worked for us, I would try to find jobs that worked around that. So, because of that, I got an opportunity to really experience a lot of different roles of different opportunities in nursing, and I just would just go with them, and so that's led me to where I am now after 40 years retiring. And then 2 weeks into retiring, I realized that I still had a few things to give back. One of them being, to mentor other nurses to help them when they get to the point where they feel like they wanna just quit nursing. And because of my experiences, I just realized that there's so many opportunities out there, and I just wanted to be help other people pivot. And the other part of this is because I also found out about patient advocacy at that point when I was retired, and learned that it was a direction I could go to and still help others. And it just really appealed to me, and I just kind of dug into it and kind of learned how to do the business side of it too. And now I want to offer that to other nurses too.
That's so amazing. And I love that you are taking your experiences. So, the unique thing about Lori, and I asked her to come on here, we actually met on LinkedIn. For those of you listening, and I always tell you when you're going out to look for people that you want to work with, is really trying to show up where they are. And so I recently shifted over to LinkedIn and started using it. Lori and I met there, and I think it's an amazing match that we met. And she's on here because of her 40 years in nursing. She's done so many different types of nursing jobs, like she explained just now. And that experience is what makes people unique. So if you're listening to this and you're like, I don't really know what I could do if I left nursing, or if I left a medical job in general, you have a ton of experience. You just have to figure out what that is. So we're here to talk about how to pivot away from what it is you're currently doing. And we're going to specifically talk about nursing because that's where Lori came from and that's what she's experienced in. Tell us, Lori, what you're doing now, how you're working with nurses that want to pivot out of their nursing career.
Well, the first thing is that I am, when I developed my program in my business of patient advocacy, I developed it with the opportunity to encourage other nurses to do the shift. And I always knew with my business model that I wasn't going to be a single practitioner. I always had a goal that I wanted to bring other nurses on as independent contractors and help them to grow. And out of that, I came to meet up with Deb and Dina from the APHA, Alliance of Patient and Health Advocates Alliance. And it was such a great start for me. And when I met them, I had talked to them about how there's a lot of education out on their site, but there isn't someone one-on-one to help them go the business side of it too, of being a patient advocate, that one-on-one experience. And I just started to talk with them about developing a preceptorship for other people that wanted to pivot and go in that direction. So we got our heads together and developed this preceptorship program through APHA and Umbra Health, which is their umbrella. And so now we offer this preceptorship program. It's a 3-month program, and I do one-on-one, 1 hour a week for 12 weeks. And we go through everything about what a patient advocate is to setting up their own business. And we give them different paths to go, whether they want to own their own business. And I kind of work in that direction. If that's the way they want to go, I kind of make it formulate the education and the training to them. If they want to go with Umbra Health offers a direct pathway as well, where you're on their platform and it gives you an opportunity for business as well. And then those that want to have their own business. So it's one is an independent contractor for somebody else, one is through Umbra Health, and then one is to own their own business. So it's a lot of opportunities for nurses to go, or others. I focus on nurses just because that's my background. So that is how I ended up doing this and starting the advocacy business and keeping to my mission about helping other nurses to pivot to where they want to go.
That's so amazing, and I love that there's different choices. So it's not just one thing that they're focused on, but they can actually choose if they wanna be an independent contractor, if they wanna do their own business, so they have that opportunity, and that you've partnered with this amazing organization. That's something that I like to highlight again for the listeners. Collaboration.
Yeah.
Collaboration is so big as a business owner. And once you align yourself with other people that are doing the same mission that you are, like Lori and I are having this conversation because we really want to help medical professionals get out of working in healthcare in the way that they would like to do it a different way, in whatever way that might be. She's working with patient advocacy. And then I know you have another program that we'll talk about a little bit later. I help really anything. Mine's very general. Whatever you wanna do, come see me. We'll work it out. But there's more people like us out there. We need more people out there like us that are you mentioned the one-on-one. I have a one-on-one program as well. That's so key when you're an entrepreneur. I would love for you to share a little bit about your experience. So when you decided to come out of retirement and you're like, "This is what I wanna do." What was that like for you? What kinda steps did you go through to get started?
So for me, I was lucky to have a friend that lived across the street who was connected up with our local chamber of commerce. And he was very, very knowledgeable about setting up small businesses because a lot of them, they attend the commerce meetings and and he's the one that actually helped step by step, like how to set up Google, Google business profile, how to set up my company name, pick a company name, how to just that whole nuts and bolts. He really helped me walk me through it, which is why I knew that there wasn't something out there for us. Now, APHA does have wonderful learning modules called Practice Up, and they have incorporated a lot of that learning modules with the program and the curriculum for the preceptorship. So they get a lot of information. Trisha Torrey was instrumental in patient advocacy and helping others and training and just helping with this whole 10-year process. It's only been about 10 years where patient advocacy really has become its own profession. And she was just huge in that. And her training, her modules are wonderful. So we get access to those. I would tell you the best thing for me that I also used was a book written by Trisha Torrey about the practice handbook, startup for starting your own business. And that was very huge because it step by steps you through that. And that's kind of was my Bible. And I literally read it about 10 times and it's all marked up and, pages are marked with stickies and all that. And, I just did that. And so reaching out to resources, finding the right resources, someone like you, to help to walk you through that is so important. And that's how I did it.
Thanks for sharing that. And this is why, again, why you and I are having this conversation is that I completely support finding what works for you. It may not be my program, it may not be Lori's program, it might be the book that, and I'm gonna put all of the stuff that you're sharing in the show notes so that people can go and find. I would love to share the book that you just mentioned and the association website so that people can go and check it out and things like that. So tell me, I know you have something new coming up in March, and I'm not sure when this episode is going to go live, but I'm pretty sure it's going to be before March. So I'm just really curious. What do you have new that's coming up that you're going to be sharing?
So, one of the things that I actually spent the most amount of time in nursing is when I became a case manager, specifically a workers' comp case manager. So, I became certified as a certified case manager 20 years ago. And I loved what I did as a workers' comp case manager because it gave me a lot of autonomy. It was flexible. I started because again, everything I did over the years was how do I fit this into my life, which I think is really important or you are going to get burned out. And so I was thinking about how hard it is to get into becoming a workers' comp case manager without experience. You have to have experience. You can't just get your CCM and then go out, and it's very difficult. So I started thinking along the same way as I was thinking about when I developed the preceptorship program. So I don't want to say too much, but let's just say that it's kind of along the same way, and I'm really excited about it. And it's going to be another way for nurses who are burned out in one way to go in another direction.
I love that. So you have patient advocacy, that's a path that they could take working with you.
Yeah.
And then you're going to have this new path that they possibly that's coming out. We don't have a lot of information around, which is totally fine. Follow
Yes.
Lori and you will
Yes.
learn about it.
Yes. Please follow me because I'll be putting things out there about it as we get closer. And yes, thanks for the shout out.
Yes, for sure. I know. We have to do that. It's because, and I'm going to go back to patient advocacy because I had a client that worked with me that was doing a patient advocacy business. And I've had multiple people reach out to me that are interested in that. And so I love that you and I have partnered because I can send them your way as well. It's something that really is just now coming into awareness for people. If you wouldn't mind, for people who are listening that don't know what it is, can you explain a little bit about what being a patient advocate is and maybe a couple of the different ways that you can be a patient advocate? Because I know there's a lot of different ways that people can do that.
Sure. So I think I'll start by saying what is the difference between a nurse and a patient advocate because that's kind of where I started in all this. It's like how do I define what I'm going to be doing now because I'm always a nurse. But the difference is it's number one, it's as a nurse we make nursing diagnoses, but as a patient advocate you don't. And number two, the biggest thing is it's not clinical. There's no hands-on, and you're not making recommendations or what you do as a patient advocate. You are the person that helps them to navigate the healthcare system. It's so it's so convoluted now that so many people contact me with I have a new diagnosis. I don't know where to start. Or my mom needs to go to an assisted living and I have no idea how to make that all happen. She's currently in the hospital and I don't know what to do. We do a lot of education. We do a lot of research help. Those kind of things, the coordination of care. So that's the kind of thing. And so it's such a natural for any nurse to do. Mainly it's just learning the business side of it is what doesn't come natural. The first time I had to actually made my first call, I was so nervous about asking for money because I didn't feel confident about was I worth enough to be asking this money? But I tell you, since that launching and that first call, I feel very confident, and I know that what we do out there as patient advocates is so important, and I have just seen so many positive outcomes because of it. So that keeps me going, and keeps me going. I'm so passionate about it that it keeps me going, and other nurses, like, they feel it too, and they see, what a difference they make. And I forget what the other question was you wanted me to answer.
The other question was the different types of patient advocacy. So, what I'm thinking is, I know from the client that I worked with, she wanted to do critical care. So, it was different than somebody maybe that wanted to do chronic health issues where they just kind of work with it. And then I know there that because medicine has so many different departments. I think about the nurse navigators that work with in the oncology department, and different things like that. So, what are some of the, I guess, specialties that a patient
Yeah.
advocate could do?
You know what I call them? I call them our niche. Like, when I'm in my
Yeah.
meeting, when I'm helping and precepting, the first session is we talk about what is your niche? What is it that you feel good about and comfortable in? What is your background? And there's so many different ones. And it's so funny you brought up the client that you were working with, because actually we touched base because, and this is what's so cool about this whole patient advocacy work, is it's not a competition. It's more about how we help each other, help all those clients out there. And so I reached out to her, and she likes to do the critical care piece, which is not in my wheelhouse, but I take it from the hospital, transitions of care, home health. That's my niche. So it was really cool to connect with her, so we both become resources for the other for patient advocacy. So that is one of the biggest things that I just really love. And the networking, I'm in a networking organization in the state of Florida. It's called the Health Advocates of Florida. And we are growing every day. And we meet once a month, and we just talk about resources and, how each of us are doing with our business. Some are just thinking about it and want to join. And so it's such a collaboration, as you said. So, but to answer your question too, further about niches, there's so many. You do not have to be a nurse to be a patient advocate. You could be somebody that does bills, and you're really good at insurance and hospital bills. And there's such a need for that out there. There's people that do Medicare, especially, or we have pharmacists that just do med management. And so there's so many things out there. That's the amazing thing about patient advocacy.
I absolutely love that. And what comes to mind is I am a military veteran and the VA system. And I just think when I go in there, because I have a medical background and I've worked in hospitals, I navigated it pretty easily, but I still struggled with how their systems are and everything. And I had to learn it. And I mean, that came to my mind. I'm like, VA advocate.
That's what for you, we are working on that. There's such a big need. I think that the VA is starting to introduce some reimbursement for patient advocacy, to have the vets be able to have us. I'm not 100% sure how that's all working yet, but I know it's in the works, and it's something that I plan to, follow up to see if it's something I can offer too. So that
Yeah, yeah, and maybe you and I can connect since I'm in the system.
yes.
So I might be able to help with some of the connections and how to navigate getting behind the scenes because I have access.
Yes, and
So,
you know what? And this is what I'm saying about this whole community on LinkedIn too. It's just amazing the people that reach out to me every day about what is it that I do, or how do I do this, and I just feel honored to answer them back and try to help, even if it ends up not being. I can't tell you how many wonderful people and resources. It really is amazing. So yeah, just like you, Susie.
yeah. Yeah, yeah, for sure. So I know we've covered a lot of stuff in our conversation, but as we were talking, was there anything that came up that you would like to share with the listeners as a takeaway? So somebody maybe they're listening and they're like, This is interesting. Like, I might want to check this out. What's something that they could do?
So they definitely could go on the APHA Umbra site, Umbra Health site, APHA, or the Alliance of Patient Health Advocates, and they can pull up the Preceptorship Program, and you can, go there. That it's also a wonderful site for information. There's another site, Greater National Advocates. That's a huge organization, lots of information. They offer you, if you want to go and be listed, your profile listed. They have a site on there for consumers to find us. There's also another site called Solus. That is another site that you can find us on, which is really cool because it's a way to connect the consumer and the advocate directly. So it's very, very cool. And um, I suggest that, or you can reach me through my website at steppingstoneadvocacy.com, or you can find me on LinkedIn at Lori Schellenberg. And we also have a business page now.
Awesome. Yeah, I will make sure and put all of this information in the show notes so that people can find it easily. Thank you so much for being here today and sharing what you're doing. It's so incredibly powerful that we're all coming together now as a community and helping support in this area. And as always, for the listeners out there, keep it simple.